for GIT 3. The first image you are going to look is alcoholic steatohepatitis. So the first changes that you can see is there's enlargement of the liver size, and on the cut section of the liver you can see the color become yellowish. Okay, so the normal color should be reddish, but now it become yellowish. The next one is hematochromatosis. So again, the liver is usually enlarged, right? Okay, and the difference now is the color become dark brownish brown. Okay, so this is actually a feature for hemochromatosis. The next one is cirrhosis. You can actually appreciate that the liver is smaller in size and also called shrunken, right? And on the surface of the liver, you can see a lot of these irregular nodules seen there. Next one is hepatocellular carcinoma. So this is the liver where you can see a mass or tumor there. And this mass and tumor are well circumscribed and has well demarcated margin. And then, most importantly, as it is actually malignant tumor, the cut surface is heterogeneous with area of hemorrhage and necrosis. Okay, and you can also see there's also a lot of these small lesions. This is not metastasis. This is what we call as satellite lesions. Okay, for hepatocellular carcinoma. The next one is cholangiocarcinoma. So this is the liver. Here you can actually see there's actually a tumor there. But what's so important about this tumor, apart from other features such as poor demarcation, does not have any capsule, it has an area of hemorrhage and necrosis there. And the most important thing is actually you can see that this tumor follows the biliary tract. Okay, so that's a feature for cholangiocarcinoma. For this tumor, this is actually a secondary tumor from other organs cancer. So this is actually liver metastasis. So you can actually see there's multiple small size tumor inside the parenchyma of the liver. And because it is a malignant tumor, of course, it has all the features of malignancy such as hemorrhage and necrosis. This is actually a features of metastatic liver carcinoma. Let's go to the slides. First, you are going to look into steatohepatitis. So when you open the link, you will see there's actually two pieces of liver. And obviously you can see the liver has a lot of this whitey space. And when you zoom to any of the images, you can actually see this whitey space is basically a lipid collection. Okay, and this lipid collection is not just big, and it actually pushes the nucleus to the periphery. It is also apparent in other cells, smaller steatosis. Okay, and what does it do is actually causing the hepatocyte to become large, and this is called ballooning degeneration. Okay, the next one is hematochromatosis. So when you open the link, you will find there's actually a core biopsy, and you can actually see the changes there and there. When you go to the high power, you can see the hepatocytes is also enlarged, but most importantly is actually it is filled by this brownish material. So this is basically hemosiderin, right? And this is a picture of hemochromatosis. In cirrhosis, when you open the image, you will be given this virtual microscope. From here itself, you can actually see the abnormal architecture of the liver, because this liver becomes nodules. As what you see grossly, it appears like nodules. It also appears microscopically as nodules. And this is actually called hypoplastic nodules, originating nodules, because it is composed by proliferation of hepatocytes. All there are proliferation of hepatocytes. This is all our proliferation of hepatocytes. And you can actually see that in between these nodules are actually areas that has a lot of this pinkish material. This is fibrosis, and this is what we call as fibrous septa. Okay. Next is hepatocellular carcinoma. When you open the link, you can actually see the background changes, which is the liver is already cirrhotic, but there's actually a tumor there. Okay, there's a tumor there already. So when you open the link, okay, when you zoom in, you can see this is actually the normal liver, and in comparison, this is actually the malignant hepatocellular carcinoma. Almost the same in architecture. It has a trabecular picture, okay, trabecular picture of the of the tumor, but the tumor has other features of malignancy such as pleomorphism, hyperchromatism, high NC ratio, and also mitosis. Okay. Next is cholangiocarcinoma. So this is actually section of liver. You just zoom into this or this area, okay, and when you zoom into those areas, you can actually see this is actually all malignant glands. Okay, this is malignant glands, right? And these malignant glands have all the 5 features of malignancy. So this is a picture of cholangiocarcinoma. And the last one is metastatic carcinoma, liver carcinoma. So this is actually the section of the liver where this is actually the nodule of metastasis. So when we open properly, you can see there's actually tissue, the liver tissue there, but somehow suddenly there's actually a malignant gland. So this is actually malignant gland coming from the bowel. So this is a colorectal carcinoma that actually metastasizes into the liver, and you can actually see the 5 features of malignancy there in the malignant glands. That's all. Thank you.